Hello, dear viewers. Today, let me explain you all about fungal disease, that is a black fungal disease. It is a type of fungal disease, comes from Mucormycosis fungal family. Now, let us know more about it. This starts with a mild symptom and can be potentially life-threatening disease, and it is of 4 types. The first type is Rhinoceros Mucormysis, and it is common in patients with frequent sinusitis and patients with high blood sugar levels. This also affects patient who has undergone kidney transplant. The next second one is Pulmonary Mucormysis. Pulmonary, the name itself indicates it is a lung disease. This type is common in patients with lung disease, cancer, and patients who have undergone a transplant surgeries. And the third one is Gastrointestinal Mucormysis. It commonly affects children and patients who take a lot of antibiotic medicines. The next one is cutaneous mucormycosis. In this type, the fungus enters into the body through the break in the skin and through the burns in the skin. And the last one is disseminated mucormycosis. This one spreads through the blood vessels and it affects all the parts of the body. Now let us know, where do this fungus live? They obviously live in the air, through droplets, and in the soil and the dung of animals. We can also find them in this type of old buildings and in the damp walls. Next, let us move on to the signs and symptoms of the disease. It starts with a one-sided headache, especially behind the eyes, followed by facial pain and fever. There can also be nasal congestion. It affects eyeballs. The swelling occurs in the eyeballs and obviously it gets spread to the whole face. People with lung involvement may have cough and difficulty in breathing. Affected skin becomes black in color and the face started to swell up. These are the signs of black fungus, that is mucormycosis. It is not a communicable disease. This doesn't spread from one person to another. Now, let us see who all are the risk factors for this disease. The person with very weak immune system. So, boosting up our immune system helps to get rid of the disease. The second risk factor is HIV positive patients and patients with high blood sugar levels, and also patients with diabetic ketoacidosis. And nowadays, it is commonly seen in patients with COVID-19 too. And with lymphoma patient, it is a type of cancer and a patient with organ transplants. This mainly affects persons who take too much of steroid injection, and this occurs in people who are already sick from other medical condition. When we find mild symptoms of this disease, probably we should have an appointment with the doctor. Your doctor will diagnose this through a swab and a biopsy test and prescribe treatment at the earliest. To know more about various medical conditions, subscribe our channel Medical Books. Do like, share and comment.